We've been monitoring this situation every day throughout each day since the first case was reported a week ago on Friday. Throughout each of those days, I've been in contact with the director of the Tulsa Health Department as well as our senior management team at the City of Tulsa, evaluating things as they evolve. And one of the frequent questions we've received throughout the week is about restrictions on events. And so we've looked at that carefully. And throughout something like this, I always think it's important to place a heavy level of consideration in the guidance that you get from experts. And for me in particular, that would come to public health experts. And throughout this week, we've been aware of the Centers for Disease Control's guidance as it relates to limitations on events, and in particular on focusing when there's evidence of community spread. And I think that's a general standardized guideline to focus on with any airborne illness. But in the last 24 hours, we've been also monitoring what other cities are doing around the country in preparation for this arriving in their community, and have had really a handful of things cause me to recognize that we need to be more proactive in Tulsa on this front.
In the absence of vaccine and therapies and more important, widespread testing, we really have to focus and emphasis on protecting those most at risk, and eliminating the possibility of public gatherings will do that. We want to focus on protecting our elderly or those individuals with underlying health conditions, and this action will allow us to do it. Now, we haven't received any test results from the state lab today, so our numbers have not changed. There are tests pending, and we're awaiting results. In the meantime, this is an excellent initiative to get in front of it as much as we possibly can, and this is what's happening, you see, in cities all over the country. I appreciate the mayor's willingness to be proactive and aggressive, and I want the community to know that we are all together collectively doing everything we can to protect them and keep them safe and healthy.
I felt pretty strongly that we ought to, when things are uncertain and public health is at stake, to always err on the side of caution. And so I visited throughout yesterday with our team at the city and with the team at the Tulsa Health Department. And again this morning, and in talking with Dr. Dart this morning, we agreed that we want Tulsa to be out ahead of this and ahead of other communities and be proactive on this.